Dr. Jacqueline Carruthers, welcome to the Valder Beebe Show live out of beautiful Dallas, Texas. How are you?
I'm doing great. How are you?
I'm having a great day, and it just got better because I get to talk to you about when unexpected health issues arise. You know, many of us are thinking of heading to the emergency room. That's how we've been trained in this country.
Right.
But is that always our best option? Please educate us.
Well, it's not always the best option. Only 1 in 7 patients are admitted to the hospital when they present to the emergency room. But listen, if you have a medical emergency, you must go to the emergency room. And let me kind of give you an idea about what kind of medical emergency. Bleeding, chest pain, passing out, those kind of issues, you need to go to the emergency room right away. Otherwise, call your doctor. Your doctor a lot of times can get you in the office the same day. They have telemedicine. They have extended office hours. They have hours over the weekend. So lots of opportunity there to get in with your doctor.
What should people do to plan ahead then for medical emergencies?
Well, you need to know your doctor's information. You need to know what medications you take. You need to have an advance directive. The advance directive kind of gives the health staff an idea of what kind of care you want once you got to the hospital. All those are real important things.
When you say health directive, do you need to bring this, or are they going to have this electronically on file? We need a little bit of more information on that.
It's always better if you bring it, okay, and plan ahead, complete it, and make it part of your record. However, if you do not have it, the hospital has one, and you can always complete it on site at the hospital.
And if you don't have one prior to any kind of emergency, can you ask your primary doctor for one?
Yes, you can. Every doctor's office has an advance directive, and it's actually been mandated that it be on record already in your doctor's office as part of the records.
Thank you so much for that information and that education. You know, caregivers are often responsible for making those life-changing decisions, or along with those day-to-day decisions. So should you take the caregiver to the ER with you or not?
Yeah. You know, it's kind of my opinion that the caregiver needs to be part of the equation. So there's a very sacred relationship between the doctor and the patient, and the caregiver needs to be part of that. Caregiver has information sometime that the patient doesn't have. We take care of seniors a lot. Some people have dementia and other issues where they can't remember things. Caregiver comes right in with medical records, can actually make decisions for the patient when the patient is not able to. Caregiver, very important. Transportation, lots of things the caregiver can do.
So, are we saying you need a little emergency kit to take with you? It needs to have your medication, who your primary doctor is, your medical information, medical form you called it. What did you call it? I'm sorry.
Advance directive. Advance directive.
I've even been asked what my blood type is. I happen to know what it is, but I've been asked that. So should I have a little bag that I'm on the way out the door? I need to take this with me. So here's all my information.
What my patients normally do is they write it down. They keep books available, tablets, and they write down every experience that they've gone through regarding their health. CAT scans, visited the doctor this day, got referred to another doctor that day, list of medications, list of allergies, all those things are real important. So write it down. Keep a book. Keep a notebook on all the information.
Today, my guest has been Dr. Jacqueline Carruthers. She's an internal medicine specialist with WellMed. Dr. Carruthers, thank you so much for that information. Where did my audience go online? Because we really need to make this happen. Right.
Learn more at agehealthytoday.com.
All right.
Thank you for having me.
Thank you for being there. I want my audience to head over there with me because we need to be prepared. Dr. Carruthers, you are just a treasure. Thanks for being my guest on the Valder Beebe Show.
Thank you, Valder. Bye-bye.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebe Show.
We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to youtube.com/ValderBB Show and stay connected as I interview the world's most fascinating people.